Welcome back, guys, to the Fitness Podcast. It's me, Emily, today, and with me I have Dr. Ash Hamilton, who is an osteopath. Welcome to the podcast.
Thanks for having me.
It's awesome. I actually want to just straight away dive into how we got to know each other, because I don't remember. We've never met. You're one of those guys who I've never met in real life, but I feel like we have like a really good friendship, which is, I don't know, I love it.
Yeah, I'd totally agree. It's one of those people. It's like you feel like you met, but you haven't. I think it was like
I remember now because I had problems with my foot, and for some reason you posted something that I had just started doing, a hip exercise, and I was like, that's funny because I've been doing this, and you're like, all right, and you actually said like, I can take a look at it if I want to, and I was like, yeah, sure, and from there it went, and you were just so helpful. Yeah, well, maybe this is not the right moment, but that's how I remember it anyway.
Yeah, with the lunges, was it?
Yeah.
That was I think like I'd been just exposed to a concept by one of my mentors, David Gray, and it was like hip extension before knee extension. And it was something that I was like kind of understanding a little bit more and trialing myself. And then you kind of you reached out and you were saying that you were doing something similar. And I think we went back and forth. You sent through a few videos, and we kind of like started chatting from there. And then I think we had like a catch-up call to kind of like get to know each other. Yeah, been in contact ever since.
Yeah, it's been awesome. So let's just go in from that angle. You know, you are an osteopath. What is your background? Like, how did you end up becoming an osteopath?
So I started off, I guess, getting exposed to osteopathy back when I was like 12. I remember wrestling was like a massive thing, and me and my friends were kind of like, mucking around, and I thought I could do this like lift. And next second my back was hurting. And I went to a few different practitioners, didn't have so much luck. And then I came across osteos, and they seemed to work the magic for me. So it was kind of like, oh, that's kind of cool. Like that helped. My parents like, oh, that'd be a good job. So it was kind of like one of those things that was like at the back of my mind. And then at the start of high school, I actually put it down in like my time capsule of, when I finish school, I'll be an osteo. Finished school, loved chemical engineering. So I did that for a year and then loved it, but realized it wasn't for me. Like I enjoyed it, but I didn't have that passion to go home and study it outside what we had to study. So then I transferred into osteo, and I guess started that 5-year journey. And I guess when I entered osteo to when I finished osteo, I guess the mindset and the path that I took or wanted to take completely changed. So first year, just did, I guess, the normal thing. I was like, I want to be an osteo, hands-on, kind of like that. And then in my second year of university, I was kind of like really into the gym then, just like gymming all the time, deadlifting, all that good stuff. And I started hurting my back a lot of the times with deadlifts, but it was also like my favorite lift. So it's like I'd hurt it, I'd get better, and then I'd hurt it again. And there was this one night I was deadlifting and my back just went. The next second I'm like, I can't move. My friends are like laughing, and they had to like help carry me out of the gym. And at that time, I was training at a PT studio in Melbourne. And my coach at the time, a good friend of mine now, Dan Black, he was like, you got to find this guy called Andrew Locke. I was like, oh, like obviously he's been recommended.
You got to find that drug dealer down the road. Look.
I was like, who is this guy? Like, is he any good? And he was a physio. So it was kind of like, I tried some osteo, but I was like, oh, like, I'll try physio. And I remember rocking up to Andrew's clinic at the time, which was in his garage. And I walked in, I was like, what type of hands-on treatments are you going to do? Because I was obviously going to compare it to what I'm doing at uni. And like, there's weights everywhere. There's like photos of like Arnold Schwarzenegger. And like, it just looked like the best gym in like a garage. And then there was like this pop-up table. And I'm like, this is a bit different. And And long story short, like Andrew had me like deadlifting by the end of the session, which was crazy at the time because I was like, I hurt myself deadlifting, but you got me deadlifting straight away. Focused on my technique, moved me from like a conventional to a sumo, and pretty much gave me all this good stuff. And I was back at the gym the next week deadlifting, and while it wasn't the weight I hurt myself on, I was still deadlifting. So at the time I was like, this is awesome. And then that kind of gave me this idea. I'm like, he helped me without kind of like putting his hands on me. Like, he moved my knees a little bit and, that kind of stuff. But like, he was able to help me without touching me. And it was with exercise. And he got me back doing what I love. And from that moment, I was like, I want to be like Andrew Locke. So I was like, how can I learn from this guy? And at the time, he was kind of like running some lower back courses like Do Not Fear the Disc Bulge. And I pretty much attended every course he had that year. And this is kind of like
top of your second or third year.
Yeah. Because I had this mindset that I was like, everyone finishes uni with the same degree. And then, they might do dry needling or cupping, and then it's, a fight for all the jobs. And I was like, well, I have 3 or 4 years left. If I do all this education now, it'll kind of like separate me from, I guess, everyone else. And that's kind of when like this, I guess, addiction to kind of like do courses kind of started, because I'd rock up to the courses, you get to learn from all these smart people that you look on social media. And then you get to meet all these cool people that are kind of like on the same journey. They're eager to like, learn from you. And then it started, you start seeing everyone at these courses, and you start becoming, friends with people that now a lot of the people I know, because of all these courses I did. So I continued my course, and I became kind of like anti hands-on. I was kind of like, well, Andrew Locke didn't need it. Like I've seen what he did, like,
save my precious hands. Don't they have to have like insurance for their hands, right? Like people do like massages and manual therapy. They have to like, it's a hard life.
And people are like, you can't play footy because, what happens if you break your hand? You can't do snowboarding. You're going to break your back or your arm. And then I actually, I think at the end of third year, I broke my finger playing footy. I was like, oh, all right. And I couldn't do uni. I was limited in the gym. I couldn't work because I was a lifeguard. And again, like this whole like, crap, what happens if this happens later on kind of thing happens. And at this stage, I'd kind of started, one of my good mates was like, Ash, like start PTing, which is probably the best thing I ever did for what I do now. But also like if a lot of people, I guess as a side note, ask us like, what should I do if I want to get into rehab or movement? And the reason why I always say is get your PT qualification is because like I'd done all these courses and I started PT and I'm like, oh, I got all the cues. And then I remember my first client and I gave him this cue and he's like, what? And I'm like, oh no, I'm out of cues.
What you said?
Yeah, I'm out of things. Like, what do I do? Like, that was like my one trick pony type thing. And it really taught me like, not everyone is like me, that everyone moves differently. Everyone has different bodies. Everyone has different goals. Like they didn't want to, lift heavy like I did. They just wanted to move and like feel better and like get confidence. And like PT is awesome because you get an hour with someone. They might train multiple times a week and you have to learn. So like say someone wants to train hamstrings. Well, you need to know quite a few hamstring exercises. One, because if the machine's taken, you can't just stand there. Two, what happens if they don't understand that movement pattern or it's too advanced? And three, like, people get bored quickly. So it's like you start building this repertoire of so many exercises, learning so many different cues and learning that not everyone understands when I perform something. They don't, because like people have different learning styles. Some are like, they need to be able to like feel it. So, getting a bit more hands-on. Some people like a visual. So like, just me demonstrating it. And then some people they totally don't get it at all. And it's like, in those moments, it's like, well, how can I try and, come up with an analogy or something that simplifies it and makes it click? So that was such a
things.
Sorry?
That was one of my favorite things to really like add the worst analogies for everything. But if it works, it works.
Yeah, and like sometimes you start talking, you're like, hear me out. I know it's gonna be the most crazy analogy. And then like sometimes you're like, that's brilliant, but it forces you to kind of like think on your feet. That's why I think like getting into PT, no matter where you want to go with PT, for me, it's allowed me to kind of be able to like, one, obviously being a coach and learning how to coach different people, getting exposed to different people, learning a whole range of, I guess, tools, but also being able to know what something feels like. Because sometimes with the hands-on, I can't be there and I can't be like, when they say, oh, I don't feel it, because you've done the time under tension, you know what to feel, kind of how to get in the positions, you can relate to people and I guess understand what they're feeling without having to do it there, then and there. And again, that's kind of like really helped, I guess, aid the movement side of things that I'm trying to, I guess, progress now.
Yeah, that's awesome. So, I mean, I want to go back to, because I think people who listen, they will go like, well, how can I go to someone who fixed me that I'm broken and they're not there with me? I mean,
Yeah,
we have the same thing as virtual PTs. It's like, but how can you train me without you actually being there touching me? But in my head, and this is again just my head, is like, is it any different? How do you coach someone through movement when they are in pain? Because I watch your videos all the time on Instagram, and you manage to help people reduce their pain within a session, right? So take me through your thought process when you look at someone. What do you do when you just come in, you sit down with me, this is the first time, I mean, I've had a session with you,
yeah.
and you just like make me do all of these things, and then you just ask the right questions, but like talk me through how you actually work.
I think when it comes to hands off or online or remote type, I guess, rehab training, it kind of starts for me. It's in the before the session. So for me, I like to send a lengthy questionnaire to kind of get an idea of what's going on. You know, what's your story? What's kind of like, you know, the legacy that your body or what has happened to your body? What has happened in your life? And that is probably one of the biggest things that allows you to then do that hands off, I guess, approach. Because a lot of the times, one, it starts building information before the consult, so you can really get into the consult a lot faster. But just like success leaves clues, so does injuries and so does past experiences. So when I look through a questionnaire, I'm looking at like, you know, did you break your thumb when you were 5? And now you have wrist issues later on. And a lot of people don't think it's relevant. And sometimes it's not. Don't get me wrong. We can't always link things to the past, but we also have to consider these things if something maybe not be getting better. And, you know, it's maybe not acute, and acute means like, you know, just happened. Chronic usually mean is time. A lot of people associate chronic with bad, and it's usually anything that's been longer than 3 months is usually what we give as chronic. So what I'll do is I'll go through that questionnaire, and I'm already like kind of building a story based off what you said. So if you've said like, you know, you've got lower back pain, you've told me how it, I guess, happened, past injuries, kind of what causes it, issues. I'm already thinking in my head, I'm like, what do I know about back pain? What do I know about the human body? And I'm already trying to build a story. Now, obviously, I don't go in and I'm just going to follow that, but I've already kind of built like a backbone about what I think's going on.
I guess you have different hypotheses what could be, and then you start to, okay, I'm going to test this and see if it would be that avenue, or nah, I'll test this, I'll go down that avenue. Is that how you think when you then sit down with me?
Yeah, exactly. Because at the end of the day, while the body is so complex, common injuries occur commonly and they happen with similar mechanisms. And so you've already built, like you said, that original hypothesis, and then we get online and I get to ask further questions. So this might be if you didn't elaborate enough, or there's something that really like kind of stood out, like kind of like a red flag. But red flags usually something serious, but like just saying that like kind of gets my attention. And then what I do is I like to do a full body movement assessment. Um, and what I do is I take you through like 3 planes of motion. So I start with like sagittal, which is like front back motions. Then I go side to side motions, which is called the frontal plane. And then I finish with transverse plane motions. Now, what I'm doing there is I'm kind of seeing how things work from like a a kinetic chain standpoint. For example, if you were to give yourself a hug and just stand up, if you rotate right, your left leg is going to come in more, it's going to pronate, your right leg's going to supinate and rotate out more, and it's going to have a chain reaction up the whole body. Now, what I'm doing is I'm like, does that move? Like, does that kinetic chain happen? Like, does that foot come in? And if it doesn't, that's where I'm like, I might zone in and start like, looking around and kind of like being a little bit more specific or doing a little bit more assessment of movement to kind of like that region. And then the next thing I like to ask is kind of like, what are your goals? Where do you need to be? And we determine a KPI. So for example, if someone says they get pain sitting down or squatting, we need to see them squat, because a lot of the time I feel the letdown with what people do is they never assess what people actually have pain doing. They just say, all right, that area hurts, I'm just going to look there and do something generic. But pain a lot of the time is specific, and it's specific to a certain movement. They might only get pain on the way down in the squat, they might not get pain on the way up. So to just say, you've got lower back pain and just go straight in and treat lower back pain, I guess blindly, is not taking into consideration the person in front of you. And that's why I like to determine that KPI, because what I like to do is I have a KPI, and then that's what we did was we test and retest, and we take the principles of what I believe will help and what I believe you need to be able to do. We do an intervention, and then we go straight back to the KPI and see how that feels. Now, pain sometimes is like a light switch where it's just like on off, but a lot of the time, what I find is, especially with these chronic injuries, it's going to take a bit of reps and sets and a bit of practice. However, I usually say to people, it's a yes or no. There's no maybes. Like if it's a maybe, it's a no. So when we go back and retest, if you're not able to say yes, then I feel like that exercise or that intervention hasn't kind of talked to your brain. And the way I like to say it is this: say someone says you need to do a glute exercise, and you're like, fantastic, another glute exercise, clams, let's go. Yes. I'm like, well, there's like 20 glute exercises, a lot more, but like for the sake of the argument, it's like you could have 20 glute exercises, and maybe only one or two of those exercises is going to speak to your brain. And that's why, my consults are longer, because I want to find that thing that is, I guess, a yes, and something that speaks to your brain and gives us kind of like a real change to that movement pattern in real time. Now, the reason for that is, one, it shows you that if you keep doing this work, that we're probably going to head in the right direction. But it also shows me that, I think we've found potentially that root cause. So I guess from like a buy-in standpoint, if you can see right here, because, if you do a traditional hands-on approach, and then at the end of the session, you get like an exercise, and there's nothing wrong with this approach. But if you get that exercise and you haven't tried it and you haven't, I guess, experimented it, well, then you're going away, and I guess you're just hoping that that exercise is going to work based off theoretical knowledge of, if you do that exercise, it's usually pretty good 7 times out of 10. But I guess I don't want to have that. I don't want to stall that progress. So yeah, that's kind of like how I go about assessing. And I guess that's where the PT comes in again. It's like learning what movement looks like. There's not, I guess, I don't like the word bad. There's, I guess, not, there's more optimal ways to move. And that's what you learn is like, that, with certain exercises, they should look a certain way and they should feel a certain way. Because that's another thing, it's how something looks is important, but it feels like crap. It's not always the best thing to keep doing it, because it wants to feel good, and it also wants to somewhat look good. Now, if you're doing like a 1 rep max squat and you're trying to lift as heavy as possible, it's probably not going to feel amazing. It's going to be quite a bit of a grind, but that's an exception. And that's like a very, I guess, a performance-based activity. But when I'm dealing with someone with rehab, I really care what something looks like, but just as much what it feels like. And I think that's really important when you're dealing with someone. And that's where that background knowledge of being a coach and doing the stuff yourself. Yeah, you can really relate, because you know what it's meant to feel like. And when they can't feel that, that's where different cues or like different positions, you're able to like problem solve to be able to then give that exercise.
Yeah, I like that. I've had my own fair share. Even before I met you, I've had my foot issue there for or I thought it was a foot issue, you know, went to foot specialist, and it was that
Yep.
they didn't touch me. They gave me what they said it was, and then they just gave me like calf races to do. I'm like, cool, take my money. That was it, you know.
Yep.
So yeah, I think, yeah, I really appreciate what you do. And you know, when we sat down, I really felt like, and this is why I wanted to keep connect with you as well. And I would recommend you to anyone. So, but I actually want to, for the listener and even for myself, because I do think that there is maybe some blurry lines there. Could you talk me through what the difference is between a chiropractor and an osteopath, and maybe a napropath as well? They're a little bit different even. But what would be like the main three things, and where would you know where you needed to go if you
Yep.
had an issue?
I'll chuck physio in the mix just because like they
Oh
usually
yeah, of
come
course, physio as well.
with the group. Now, this is one of those questions that I guess I've had a bit of rehearsing because you get asked it all the time. It's like, oh, osteo, it's either what's that or how are you different?
Yeah.
And I'll answer this question by saying it's not the discipline. So it doesn't matter if you're chiro, physio, osteo, it's the practitioner in my eyes. Because I know osteos that treat like physios, chiros that treat like osteos, physios that, you know, treat like both. So it comes down to the practitioner. But that being said, now my understanding from, I guess, you know, how they have, I guess, established themselves and the names and the general gist of kind of like where to go. Chiropractors, they focus a lot on the spine, and manipulation is really important. So, you know, manipulation, I guess cracking is another way that people usually know what manipulation is. To kind of get those, yeah, to kind of get those like segments nice and moving well and kind of get that range of motion back. Physios do a lot more rehab. So I guess they're a lot more movement focused. They work in hospitals as well. And they're kind of like people that, you know, if you've had an ACL surgery or, you know, you've had a stroke and you're rehabbing that. But they also do sporting injuries and, you know, common injuries that we have from day to day. And then I guess osteo is a bit of a hybrid. So a traditional osteo can do manipulation. We can do a little bit of exercise, but traditionally that's not, I guess, our specialty. And we're a lot more hands-on. And I guess the one thing that I guess osteos like to pride themselves on is how they view the body. And, you know, they love that word holistic. I'm not the biggest fan, but pretty much just viewing the body as a whole. And I guess an example is if you hurt your elbow, I'm going to look at like your shoulder, your wrist, your elbow, and probably your spine. And I'm going to kind of see how, you know, maybe restrictions in one area is having an upstream or downstream effect to kind of like, you know, impact that elbow. So I think that's kind of like, I guess, a general gist. And then naturopathy, I guess they look at more, you know, natural remedies, looking at your hormones, your gut health, and things like that. So maybe someone has food sensitivities or some gut issues or maybe some breakouts or a bit of inflammation, they might be a best bet. But I'm not too familiar with, I guess, their profession.
No, cool. That was pretty a straightforward answer, at least for me. So what are your goals then? Like, because I know you work, you've established yourself online mainly. I guess you still do a little bit of one-to-one, but what happened during COVID, and where are you seeing yourself going from there?
Yeah, again, I guess like just like at uni, I had that, you know, of experienced something and it's led me a certain direction. So during COVID was my first year out of university. And yeah, we got hit pretty straight away. And it wasn't a traditional year to be a graduate, I guess, starting out. And one of the hardest things was the restrictions being in Melbourne and, you know, being at stage 4 at times was they made it very hard to see people and also to build like, you know, that clientele, that reputation, get those clients coming in. And, you know, I was kind of like, you know, I've just finished uni, I want to make money. And, you
And you
know, I'd
also
go to
did all of like the extra curriculum on top of everything. So yeah, I bet you would have.
Yeah, it's like I've spent a lot of money. I want to make it back. And what kind of happened was it was quiet, but we knew like everyone was kind of quiet. Clinics had to get shut down. We weren't working at full capacity and we're very limited. And I saw it as a time to kind of hit the books. I was like, I hope once this thing passes, we don't know how long, but I'm going to use this time to keep studying. So what I did was I invested in more mentors and more courses, and kind of helped them bring everything that I'd done together and kind of like systemize it and make it a lot easier. And I was very fortunate to meet David Gray and Gavin Howard, another mentor of mine from Australia. And I worked closely with them, and they both helped me in different ways. And David is completely online pretty much. He does in-person stuff, but just like everyone else, he adapted, and he probably adapted a lot faster than everyone else. And he was, thriving online. And I was kind of like, this option of being online kind of like brings together what I love. It's like, it's movement, it's hands off, and COVID can't really get in the way of, unless it's, the Wi-Fi starts attacking the COVID starts attacking the Wi-Fi. So I started like learning, not learning, because I learned a lot, so much, and I'm so grateful for them. And, they are two mentors in particular that I thank a lot of the success that I'm starting to get and a lot of the confidence I'm starting to get to those two. Obviously, all those courses and all the mentors before them, they've helped me obviously get to where that was. But I started using that time to obviously study and put things together and be like, all right, well, how can I systemize this and how can I simplify it to kind of be able to do this online thing? And I was like, I want to get online. I really like this idea. And I did David Gray's online webinar, which is kind of like a great introduction. It's like, if you want to get online, here's some quick tips to kind of set yourself up. So I set myself up online, and, I just left it in my Instagram bio. And then one day someone reached out and they're like, hey, can I do an online consult? And I was like, yes, yes, you can. And what I realized was it was completely different to anything I'd ever experienced. Now, in a traditional clinic, I felt like I struggled to build rapport with people. It was a lot of small talk. It's like, how's your day? What are you doing in the week? You'd be treating and trying to explain to them. But the time was very, it's very quick, in, out type thing, because you've got other clients. Whereas online, there's something about it where the rapport, like, there was no small talk for some reason. It was like, I got to know people really well, just like I got to know you just through like Zoom calls. And it allowed me to ask a lot more questions and take my time and get this deeper understanding of the person in front of me. And then really take that time to get to the root cause and take our time to, trial and error and test and retest and formulate this plan and like map it out together. And what I found was it was such a great experience for me, like, as a practitioner, but I felt like even though it was different, it was something that I'm like, I feel like this is something I want to get more into. And then, I got, a few more people. It was now like once a fortnight I get a call. And then, it started becoming weekly, and then it started picking up. And now it's where it's pretty much 95% of my business. But that online, it's something that I really love. And I think it's that ability to slow down, to really get to know people, to like get to know them before you even get on the call. That's why I got the questionnaire and the emails and the messages back and forth. So I feel like I know the person. So when I get on the call, they feel like they know me a little bit more. They're more open, and they might tell me some things that they might not have told me straight away, but it could be the missing link to why they haven't got better. Because that's another thing that I guess the niche or the people that I'm attracting is they've kind of seen other practitioners and they've tried other approaches, and it hasn't worked for them. Not to say that it's the wrong approach, but they're willing to give, I guess, my approach, something a little bit different, a shot. And yeah, like the results that I'm getting, like I feel confident that they're the same results that I would get if I was in person. And the results I'm getting, I don't need to place my hands on you. And I think it's because it's such a thorough approach, in my opinion. Which I guess back to your question is like, where do I want to go? It's like, I would love to be predominantly online, because that's the other thing. I get to meet people locally, interstate, internationally, and that's something I never thought would be a possibility. And it's kind of cool. Like I love travel, and when COVID, you can't travel, to get to, speak to you from Sweden right now, or, someone from UK, or, Singapore, or wherever. It's really cool because like you get to meet new people, you get to, it's a longer chat. So I get to know you a little bit as well. And then I feel like, there's this kind of friendship that forms as a result. And then going forward from that, like I just want to be the best practitioner I can be. I want to constantly keep studying, but ultimately I want to be able to give people hope. I think hope is something that is massive. They talk about, people that are sick, and the ones that have hope are the ones that usually get through. And, unfortunately, a lot of people have had bad experiences, and they've lost that trust, and they've lost that hope, and they just think it's their new way of life. And it doesn't sit well with me. So I want to be able to, build a system of healthcare where you feel like you've been listened to, where hope's been, reinstalled, and that you kind of like take what you have from coaching, where it's like, I coach you through the process. We get off the call and you got an email, you've got videos, you've got my information to communicate with me 24/7, to send me messages, to send me videos if you're unsure, because I don't want you to wait till the next consult to be like, hey, by the way, I got confused, didn't know how to do the exercise, or it started hurting on day 4. I want you to message me like, hey, let's stop, do this, send me a video, let me know what's happened. Let's adapt. Let's make changes now so that you can keep progressing. In the next consult, we hit the ball running, and we just tick the next box, and then the next box. And that's what I really want to do, is kind of create this journey and this experience from, I guess, what I like to call like pain to performance. And I want to be there as part of the journey, because I think people deserve it. And like in my eyes, I feel like as a health practitioner, like that's my duty, is to kind of like help you and kind of problem solve, but also to teach you. And that's one thing I guess I love about the online, is it's a lot more education. It's teaching you, it's like, you're going to be all right. I know pain is scary, but pain is just a light on the dashboard. And a lot of the times it's not bad. It's just simply saying, hey, check out that region. We're not sure about it, so we're not going to turn this light off. And you go there, you give the body some confidence, whether it's through strength, whether it's through a bit of coordination or a bit of movement. And then the light bulb goes off. And to show people that they can do that themselves, or just show people it's like, it's all good to, go in with fancy words and be like, it's the trigeminal nerve and all this stuff. But, to tell people, it's like, hey, can you see how this from your past has impacted what happens now? Or see that movement that you always do, and you get pain every time you do that. Can you see that there's a link? And they're like, oh yeah, because sometimes people don't associate things. Just like they don't associate that broken thumb once upon a time might be the reason why they have wrist pain. It also might not. But when they start linking the dots and they have that aha moment, and if they can get off the call and tell their friends, their family, the explanation of why they're in pain, I think that is a great outcome. Because, it's just like speaking another language. If you started speaking Japanese right now, I'd get off the call and I'd be like, I cannot recite that. I don't even know what you said. I hope it was nice. But like, if you get off a consult and, you've had all these words thrown at you and you don't know, well, then you're not left empowered. And like, if you're empowered, it means that you can make changes. Because I don't want you to come back. And it sucks sometimes, because I'm like, I love the banter, I love the chats, I love like checking in. But if you can go away with those skills, not only can you pass those on, but it means that you can then start, understanding your body a little bit more. And I think that's one thing that, we're not really in touch with ourselves or understand our body enough. And I think that's where like reliance on, I go there and I get fixed. And I don't like that word, because then it's like, it means that you can't really do it yourself. Like, what happens if COVID happens and the clinic's closed? Like, do you have to be in pain then? And yeah, so that's kind of like,
I like
sorry?
the thought of virtual, because it gives back the responsibility to the person who is in pain, because essentially that person is the one who's going to have to change something. And if you just go and, I mean, that's how I used to see it when I was an in-house PT. You know, I would train people for a very long time, and it could have been a year later and I'd be like, right, we're going to do some split squats, and they still didn't know what a split squat was, meaning that they wouldn't be able to take that away and go and do it themselves. Whether that was my fault as a coach or whether they genuinely didn't care and they intended to stay forever, doesn't really matter. But the fact is that I think it should be an empowering thing and give back the responsibility and ownership of one's body, which then means if you can teach and then can go away and do, that is the best possible outcome, at least in my opinion.
100%. And like, I'll say this now, like, I'm not anti hands-on. Like, I love hands-on. I wish I
love
was.
hands-on.
Yeah, like, don't get me wrong. Like, if I get injured and it's like I wake up in the morning, I'm gonna see someone that can, like, I guess, address me straight away with hands-on. You know, there's something about that hands-on that helps relax people. And it feels good and like it does work. A lot of people are, you know, in the movement space are like, hands-on's a waste of time. Hands-on doesn't work. Look at the literature, look at the evidence. And I say, like, that's a load of shit. Like, hands-on has a very real place in getting better, but just like training alone is not going to get you lean, just like, you know, nutrition alone is not going to get you lean, you need to go to the right thing at the right time. And that's where integration is so important. You know, hands-on approach might be the beginning, but it's certainly not the end. And I like the saying, it's like, you didn't get hurt on the table, so a lot of the time you're not going to get better on the table. And that's where I think that, you know,
that it
sorry?
leads to it would be like the quick fix to take away the pain temporarily so that you can then integrate the other things that you need to move better.
Exactly. It's like, once I'm, you know, I'm feeling a lot better and I'm not so, you know, I'm not in this fear state, because sometimes you just need to go to someone and be like, you're going to be okay, to help relax someone, because no one in a tight, stressed up state is going to be able to do the exercise as well. So if we can get that, you know, initial hands-on treatment to kind of calm things down, to get things moving a little better, they're in such a better place and they're more likely to do the exercises you give them, which we know, and what I guess I believe in, is going to help get rid of it and hopefully make sure it never comes back.
Yeah, I agree. I remember now why I resonated so well with you, because I feel like I want the same thing as you, but obviously from a whole different point of view. I'm a coach and an online virtual personal trainer, right? So yeah, hopefully my job is to save people from going to your to your clinic,
Exactly.
right?
And that's the
If I
other
do my
thing.
job properly, no one gets, you're out of business.
Well, like, that's not even a bad thing. And like, that's another thing that I think, like, a lot of people in allied health need to start realizing is coaches have a very real place. You know, a lot of people are like, oh, you know, coaches, you know, they're not as qualified, but some of the smartest people I know don't have degrees. They're just coaches. And when I say just coaches, I don't mean that in any disrespect. Like, most of the people I've learned off are coaches, and coaches have such a big role in prevention. And like, if people can start like networking with coaches and, you know, learning from coaches and dropping the egos a little bit, I think we could learn a lot off each other. Because, you know, if that person's training 3 times a week for an hour with a trainer, that's a lot more time they're spent and a lot more chance of preventing them going to you for like half an hour. And as we know, that 3 hours is going to have a much bigger impact on anything you can do in 30 minutes. And that's where, like, you know, what you do, what are all these other coaches that I look up to, and I'm like, they are great coaches, I would send people to you, is all that, because coaches do so much. And I don't think they realize it's like, you have to deal with their psychology. You have to deal with their nutrition. You have to deal with like them on a good day and a bad day. You have to deal with them, their movement, and you have to piece this all together and then coach them. And like, you know, from what I've learned is like, coaching people is nearly harder than anything else, because I could give you the best exercise in my opinion, but if I can't coach you, if I can't relate to you like coaches are so good at doing, well, then they're not going to do the exercise. And that's where I look at people like yourself who are coaches, and I'm like, they should be, you know, there should not be this hierarchy. There should be like this one line and everyone's on it. And like, you know, we're all patient centered, because at the end of the day, everyone got into these professions because they want to help people. And unfortunately, along the way, people start forgetting that, and they stop forgetting that there's a person in front of them that's paying them money because they trust you and they just want to be better. And that's where we can take bits and pieces. And that's why, like I've said before, it's like we shouldn't have physio, chiro, osteo, myo, EP, all these things. It should be one discipline. Take the best from everything. Chinese medicine as well in there. And it's like, you know, and coaches chuck them in there as well. And it's like, how can we learn off each other? Because anatomy is anatomy and the physiology is physiology. And everyone's good at one thing. Like chiros are great at manipulation. Physios are great at this. Osteos are great at that. Chinese medicine are good at that, this. And you get the idea. And it's like, we should stick this all together. And like, what we'd be able to offer people would be so damn good, because it's like you're taking the best parts and making it one thing. Instead of, you know, trying to be like, oh, chiro's better at this, osteo's better at that. It's like, no, you're just doing,
And then
they
they're
do
like
that thing.
talking shit about each other on like each side of the room and go like,
Yeah,
oh,
and it's like
physio's
these
shit,
turn-ons.
caros are shit. Like, no, everyone is good. You just
Yeah,
know what it is that you need, and it needs to be applicable to the person in front of you.
exactly.
Yeah.
And I think that's where like people that have realized that and formed these great networks, they're the ones that like they're busy, like because people are like, wow, they don't want to try and do everything themselves. They respect that everyone has strengths and weaknesses, and like just like with rehab, like I'm not good with weightlifters, like, you know, Olympic lifters. It's like that's not my area specialties. There's people that is, so it's like I need to send those people there instead of trying and hoping, because I want to be, you know, the go-to practitioner, which, you know, in some respects I do want to be, but you know, it's not patient-centered and it's not their best interest if I try and do that. And like if there was one thing that I could kind of hope for, it was if that integration approach.
Amen. So I could sit and speak to you about this forever, but I just want to let people know where they can find you. Whether or not they're just liking what they're hearing, and whether or not they're in pain, if they need help, like how can they find you? What's the best solution?
So you can find me on my Instagram at dr.ashhamilton, and it is doctor only because I'm an osteopath. So Dr. Ash Hamilton on Instagram, and I might as well release it now, because by the time this podcast is probably released, my website will be called The Hands Off Osteo. And that's where you'll be able to, I guess, find more about me, a little bit kind of like who I am, and I guess the different services I have to offer.
Amazing. Looking forward to that website. So thank you guys for listening in. As always, we appreciate your feedback. If you have anything that you wonder about, just give us a shout out, and do check out Dr. Ash Hamilton. See you soon.
Thank you so much.